on? Okay, thanks, Blake. So, we're back. Another episode of Doc Talk Live has just come together in the last 2 hours, I'd say. So okay, Doc Talk Live. I'm with Janis Randall, Janice Cardwell. Janice is an old friend of mine. We go back many years. Janice is a pharmacist, a compounding pharmacist. Janice Cardwell is hopefully a former patient of mine. It's been a few years since I've seen you.
Yeah, you fixed me. I didn't need to come back.
And you fixed me too.
That's right. That was what, your tennis elbow? So
absolutely.
Embarrassing me. But let's seriously, you can embarrass me. So you texted me earlier today and you said you wanted to talk. This is what you said. You said the governor has approved CBD oil or CBD, blah, blah, blah. CBD is the rage. And so I'm like, okay, come talk to me. That's fine. And I'm like, well, I want to do it on Facebook Live. So we haven't talked about it at all. Whatever you want to tell me, tell them. Okay?
Okay.
Go ahead, tell them.
All right. Well, the first
Wait, why are you here again?
2 important reasons. One, I will love you for the rest of my life because you fixed my back and I can walk and dance and move and work and go on with my life after you treated me.
Good.
2, because I'm actually a business partner with this other amazing Janice, and
So you work with Janice.
Yeah, we've been working the business together.
The CBD business.
Yes.
Okay. And when did you get into the CBD business? Like 2 months ago?
Well, actually, it just became legal for me to come into it right after Governor Ivey descheduled hemp. Because it had some THC in it, a tiny, tiny little trace, it still had to be a Schedule 1, but it had to go through our regulatory boards. And then when it was passed, then she signed off, and now pharmacists, in addition to gas stations and vape stores, can sell you quality CBD oil.
Okay, and that when did that happen?
They've been selling it for a while, the other places.
No, when did the governor?
Oh, last Monday afternoon.
Last week.
So this is like just very, very recent.
Hot off the press, yeah.
And so the question that comes up a lot really is not so much is it legal or is it not, but people who get drug tested, they're worried that if they're using CBD oil for their pain, that they get drug tested and they'll fail their drug test. So any information on that? Does that come up in your clinic?
It does come up, and I'm going to get Janice to join me on this, but our product has a QR code that you can actually look at it and you can find out how much THC is actually in here. And it's for the most part, you have more experience than I do at this. Hasn't it been like we have never had anybody test positive for it?
Yeah, so the company's been around since 2015 and we have over 50,000 representatives across the country and no one has ever popped positive on a drug test. Because these drug tests don't test for cannabinoids in general, they simply test for THC. And so this scannable QR code will take you to a lot number, a batch number, which will direct you toward a certificate of analysis produced by a third-party lab, and it will tell you the exact isomer, for instance, Delta 9 THC, and it'll tell you the exact percentage in each batch. And typically it'll say less than 0.0015. So we do say it's less than 0.
So you're saying while these products have like trace amounts, like homeopathic amounts of THC, to your knowledge, you shouldn't test positive for pot. Basically.
I could order you 4 cases of bottles and you chug every single one and then go TT for a test and you will not pop positive.
Okay. And I've done a show on CBD before, and it was fascinating. But not everybody is watching these shows. So what is CBD? How does it work? What's it for? Give me the skinny on that.
You want to check that?
Well, yeah, we can talk about it. So one of the primary misconceptions about CBD is that it comes from pot, and there's this huge stigma around pot, marijuana, whatever you want to call it. Oh my gosh, am I going to get high? So that's simply not the case. So as you can see from this cute little diagram right here, cannabis is basically the parent plant. And this parent plant had 2 fraternal twins, right? So one is hemp and one is marijuana. Drastically different plants, drastically different extractions from these plants. Hemp, really high CBD and almost negligible THC. Marijuana has the reverse, mostly THC and very little CBD. THC is the compound that has the psychoactive properties. So that's why marijuana gets you high and hemp does not. The only way you can get high from hemp is if you make a rope, tie it to a tree, and climb it.
Okay. Got it. So how did we discover that hemp is good for pain, or where are we with CBD/hemp and helpful for pain? How did that all come about? How did this excitement? It's on everybody's mind lately.
Sure. I really think it started in California with some doctors doing research and actually using it in their practices. California seems to be kind of on the forefront of a lot of medical discoveries. So this desktop reference that I have right here was written by a doctor that has included it in his practice for 30 plus years, and I've got 400 clinical studies referenced in this book of information. So
what are the most common things that people are using CBD for?
Well, can we talk about the endocannabinoid system
Please.
first? Okay.
Yes.
Our listeners are
Yes.
dying to know about the
Do
endocannabinoid
What do you
system.
know about the endocannabinoid system, Doc?
That's a great question.
Let's talk about this. Did they
review.
teach it to you in medical school?
Absolutely.
They did.
I'm sure yes, they had to have. They had to have.
Listen, I got my degree in sports
No,
medicine
no.
in the 90s, and we didn't know anything about the endocannabinoid system.
No.
It was only discovered in the 90s.
I've heard about cannabinoids since I was in college.
Well, then maybe you went to a better school than
Cannabinoids. Well, all right. I don't know.
Talk about the endocannabinoid system. Let's talk about it.
Okay, well, we have been exposed to hemp for years and years and years. In 1936 or 37, the government got concerned about marijuana use, and so they sort of did a number, and they were able to get hemp oil and CBD oil off the market. In fact, Eli Lilly made several preparations of it that was wiped off the market. Some of the other big pharmaceutical companies made it and was all wiped off the market. Now, we were exposed to hemp through our clothing, through tools, through baskets, through things that we ate, and so we developed this endocannabinoid system that had receptors for cannabinoids. We actually have an endogenous system, but we
There's the endo.
Right?
Endogenous.
What does
It was
endo
on the
mean?
tip of my tongue.
What does endo mean, Doc?
It means endogenous.
It means inside.
Inside, within
Yes.
us, within our bodies, we've got these cannabinoid
Yes.
receptors.
Exactly.
And these cannabinoid receptors somehow have something to do with pain modulation, I take it, right?
Yes.
Yes? Okay.
Take it away.
Okay, so I don't know if y'all can read this. CB1, so that must be cannabinoid 1, and CB2,
There are 2 types of
cannabinoid
receptors
2.
throughout your body.
And so CB1 is involved with various things like Alzheimer's, Parkinson's, headaches,
Mostly
depression.
neurological issues.
Okay, and
Right.
CB2 looks like it's involved with GI stuff and rheumatoid,
Things that are said
more,
to be autoimmune.
more autoimmune. Yes. Okay. All right. So these are a lot of conditions that potentially CBD can be good for. When we take CBD, are we taking a combination of CB1 and CB2, or are there like products that are more geared toward 1 or 2?
These are the types of receptors. These aren't actually cannabinoids. So you have 2 different types of cannabinoid receptors in your body. CB1 receptors, CB2 receptors. These are the locks, right?
Okay.
This is the way I explain it to lay people, is that you have all these locks throughout your body on almost every single cell. Well, CBD happens to be a master key to fit every one of those locks. So depending on where you're deficient, this master key can fit whatever lock is unfilled at the moment. It can turn processes on or off depending on if your body is over compensating or under compensating, right? It can upregulate or downregulate. It's an adaptogen. It works to whatever deficiency you have.
You made that up, adaptogen. I love that word, but you made that up.
I didn't make it up. Feel free to use
Somebody
it again.
made that up. And
You're going to be using that with your patients next week. I know you
I
are.
love that.
So it gets you to homeostasis.
Okay.
Right.
In my little example, and it's probably a crappy one, when you hear what it is, you're going to laugh. You can have diarrhea or you can have constipation, but wouldn't you rather be in the middle? So therefore, that was a crappy analogy.
No, that's great. No, I like that. That's great.
Was the crappy analogy, was that it?
Yes.
It wasn't fun in itself.
Okay, so what am I holding here? This looks like a topical, right?
It is.
It is a topical. Is anything hurting on you?
Well, could I use it in my hair? Would it calm it down a little bit? That's what I want.
I don't know. I'm enjoying its wild natural state right now.
We've seen it work for people with anxiety, and that your hair might be a little anxious.
It does
definitely
have
not
a little,
depressed.
It does have a little odor.
What do you think it is?
It's like a menthol type odor.
It's got some pepper and
Yes, so in addition to our proprietary Ultracell formula, it's got a few other things in it to make it feel more luxurious and absorb quicker, and also add to that entourage effect. So there's citronella in it, which
Citronella. Okay.
yes, in addition to repelling those giant band of mosquitoes that we have, it actually helps with joint inflammation and pain.
Cool.
Yeah.
Citronella. Okay. And you have a bunch of more stuff with you, like
Would you-
drops and stuff like that.
would you be
Goodness,
interested
smells
in
so
having
good.
a little sublingual drop?
I mean, I'll try it. Why
Okay.
not?
Let's
Your
do
hand's
it.
probably steadier than mine. Now
Okay.
this is the raw. This means it has no flavor and no sweetener like stevia in it. And this one has a little stevia and it has a berry flavor. Which one? Or you
No
can try
flavor.
one.
I don't want the stevia.
Okay, all right.
Okay. So this is it's called raw because it is our CBD extraction in its purest form. Like she said, no sweeteners, no added flavors. Some people are concerned that the flavors have a little bit of stevia in there. So if they don't want anything artificial, then they go for this raw.
That's not it. I just don't like stevia, so or that that much. So let's go for
So
the raw.
this guy, it tastes like grass. It's
Okay.
very earthy, but
Okay.
it's wonderful and it disappears really quickly.
Okay. All right.
So
Keep it under your tongue for a few minutes before you swallow it.
How am I going to talk to y'all?
Oh,
30
you'll just have to be quiet for a second.
okay, so this is under the tongue. Yeah, wow, good, nicely done. Most men I say under the tongue and they go because how men follow instructions. You're doing great. You're doing great, Doc.
You want it to dissolve sublingually because if you swallow it, it's going to go through your GI system and first pass metabolism.
Can't help it. I had to swallow. So is it just one drop?
You actually used half
So
an
many
inhale.
punchlines right now.
Okay.
You're setting me up here, Doc.
Go for it, Janice.
Now I've lost my train of thought. I think I'm like.
That's what happens when you sit
Totally
between
blank.
two Janices.
So maybe it's good for anxiety. Is that?
We've seen people respond to that. We've been trying to get our dog to take it, and my husband's the only one that the dog will let touch, But he forgets to give him, and I keep saying, I need a good testimony for a dog.
So that's actually important to note that this formula has no xylitol or anything that's harmful to pets. So this formula is safe for your pets. My dog and I dose together in the morning. This is true, you guys. This is true. So my dog is a
Does he wake you up like on the dot, ready to get high? I mean, what's...
She's a 12-year-old rescue, and she kind of mirrors my activity level around the house. If I'm just kind of laying around, she's doing the same thing. She's not very energetic, not very playful. So I started putting this on her food twice a day. I take my half meal and put a couple drops on her food twice a day. She's so spoiled and so smart now. If she doesn't see me put the drops on her food, she won't eat until she sees the blue bottle.
Wow.
Not kidding.
Yeah, I saw a video of it.
I took a video of it. That's true.
amazing.
So now every day when I come home, she's jumping all over me wanting to play, and it's really kind of, rejuvenated her. And she can't talk to me, but I think it's possibly because she doesn't have joint pain, and I think it's even helped her lose a
She's
little
an
bit of
older
that
dog, I'd
middle-aged
say,
paunch.
right? She's an older dog, is it? Like...
She is. She's been rescued a couple times. She's a black lab and blue heeler mix, and she's roughly 50 pounds. So I put 4 drops in the morning and 4 drops at night.
Okay.
Would you mind if Janice told us her personal story?
No, not at all. In fact, I was like, should I ask or shouldn't I ask? Why do you take this stuff?
Okay, so it might get kind of serious for a second, There are tissues over here on your station if you need them.
I'll go get them.
I'm just gonna.
I'll go get them. But I've already taken my CBD, so
Well, then this may not bother you.
I
You
should be
be
good.
good. We just
All right.
dosed you, so
Exactly.
you'll be
All
fine.
right, go
You're
ahead
immediately
anyway.
cold-hearted.
Right, yeah, you're good. No emotions after that. You're fine.
Okay.
Long story short, a year ago, I lost my boyfriend on our 4th anniversary. He passed away suddenly of a cardiac event.
Ugh.
And my go-to to function, pharmaceuticals. You know, I went to my gynecologist because I don't have a GP. I just never get sick, so I don't have a GP. She's the only medical professional in my life, so I went to her, told her what happened, you know, flooded her office with my tears and didn't know what to do. So she pulls out a prescription pad, just like you're taught to do in medical school. You pull out that prescription pad and you sign off on something that nobody can read but your nurse practitioner. So I ended up with a prescription for Lexapro and Xanax. And for 5 months, I depended on that to live, to get out of bed in the morning, to put clothes on, to go to work, to function. And several months into that, I was determined to stop. I did not want to be chemically dependent on a prescription. I was dealing with side effects, and I just knew that this wasn't the way for me to continue functioning. So my now business partner, another friend of ours, introduced me to Zalise and Ultracell, and I said, I got to get off these drugs. These things are not doing me any favors. I gained 30 pounds within 3 months. Blew up.
But don't you consider this a drug in a way?
Absolutely not. It is
Okay.
considered a dietary supplement. It is definitely not a drug.
But it's something that you're using to substitute for, let's say, pharmaceuticals that are, this may be more holistic and healthy, but it's still something that you have a dependency
Well, she
on.
wasn't Xanax deficient though, and
Right.
she wasn't Lexapro deficient, but she might have been cannabinoid deficient.
Right.
Okay.
So if you're missing vitamin D and you walk out in the sun, it's the same thing. If you're deficient in
Sure.
certain things that your body normally needs for homeostasis,
Right.
and you fill those gaps, that is
But
a
we don't.
natural way.
But we can measure our level of vitamin D and say, hey, we're vitamin D deficient. We don't necessarily have a lab test that says we're CBD deficient. What we can say is, hey, I take Lexapro, I feel better. I'm deficient in Lexapro. Or I take CBD, I feel better. I'm deficient in CBD. So I think we may be splitting hairs a little bit, but I'm just pointing out that it does seem to me that we have substituted one is it dependency? One dependency for another, and perhaps that's a much better substitute. Now, maybe if we could substitute sunlight for CBD or exercise for CBD, that would be even better. So
Do you take any supplements?
I don't.
No vitamins, no.
I've taken them in the past, but I'm so non-compliant that I've totally given up on it.
Do you recommend that your patients take any?
I sometimes leave that to like Dr. Maddox, who's my primary doctor. He recommends I take vitamin D, for instance. I actually do take B12, because I am B12 deficient, and it's a shot once a month. I hate it. I complain about it all the time, but I am prescribed vitamin D and I don't take it, so I am non-compliant with that.
Okay. I would imagine you're non-compliant with a lot of things.
I don't know about that. I don't know about that.
So-
I mean, I do brush my teeth every day.
To sum up my story,
maybe I don't floss as much as I should. But go
I'm
ahead.
telling your dentist. To sum up
They know.
my seemingly serious story, I was able to get completely off of all the pharmaceuticals. My withdrawal symptoms were compressed only into a couple of days instead of several months. I've heard horror stories of people coming off meds and dealing with vertigo and sleeplessness and all kinds of other issues. And I did experience those symptoms, but like I said, for only a couple of days. And I know that the CBD helped me deal with all those deficiencies in my body. In addition, I have lost 25 pounds.
That's awesome. And I wouldn't do a show on CBD if I didn't think there was something to it
Right.
or something that could be useful for others out there.
Well,
so yeah,
we Janices enjoy a challenge, so we're happy to keep answering your questions.
You ready, Janice?
I think so.
So if you were on a desert island,
Uh-huh.
okay, and you could only take 3 drugs with you, you're a pharmacist, right?
Mm-hmm.
And you know, like that movie, you know, that Tom Hanks with Wilson, with all,
Yeah,
right? If you
yeah,
could only
uh-huh.
take 3 drugs with you, what 3 drugs would you take? I'm just curious. I don't know.
Okay, well, I really wouldn't take any drugs, but I would take some supplements because I'm not dependent on.
So you wouldn't take like an antibiotic. Let's say you got a urinary tract infection. You wouldn't take like a broad spectrum antibiotic, or maybe you wouldn't take something like a Benadryl for like antihistamine if you had an allergic reaction, or maybe like something for pain if you broke a bone, like morphine. You just take vitamins.
Well, actually, see,
I think I would take some real drugs with me.
He has thought about this question before.
Clearly.
He's not.
Clearly, but I mean, think about it. I mean, you're on an island, and it sort of informs you like penicillin is an amazing drug.
true.
I mean, before penicillin, people were literally dying of I wouldn't say minor infections, but infections.
True.
So I don't know. I'm just.
Let me answer it. Let me
Go
just
ahead.
say, my orientation might be different from somebody else's. I have never missed a day of school or work in my life. I'm just incredibly healthy, so I've never depended on antibiotics or anything. So that's not the first thing that came to my mind. But I definitely take CBD oil because it has antimicrobial properties. It has a number of things. So it might could be a general fix. I don't know if it would cure a snake bite or something, but I would take that. And
That's a good point. So it depends on the island.
Mm-hmm.
Right? If you're on an island that has a lot of snakes, you might want to take something that would. Seriously, I mean, it just depends on location. Really would matter, right? If you're like, where you might want sunscreen, even, right? If it's just
me.
Not me, but everybody else would. I'm such a naturalist.
Right. Where are we with this, Blake? Do we have anybody that has any dying issues for us?
You're going to start incorporating arnica, right? Is that
Arnica?
arnica? Is what's
You're going to start incorporating arnica too, right?
this question?
Arnica. Do you know about arnica?
I know a little bit about it, yeah. Plastic surgeons recommend that you take it a few days ahead of the surgery because it reduces bruising and swelling.
Mm-hmm.
Y'all have anything to add to that?
Do you have arnica in your clinic?
I've had it in the past. I don't have a whole lot of walk-through traffic, but I can order it.
You can. And how does one take arnica? Is it a by mouth or is it both? Is it something that can be rubbed on?
Absolutely.
Arnica. Interesting. Anything else there, Blake?
Did y'all talk about the legality?
We started. We talked a little bit. Governor Ivy apparently legalized it, and on Monday. Last Monday. So
I guess there was that. I don't know if you saw the story a couple weeks ago now. Where there was I think it's probably Disney World because Disneyland possibly.
Yeah.
Where the grandmother gets like arrested for possessing CBD oil.
Those are uninformed officials. So if you start at the top, the Farm Bill in 2018 federally deregulated hemp. It descheduled hemp. So it made it into an agricultural commodity as opposed to a Schedule I drug. So starting on Capitol Hill, Farm Bill happened, Trump signed it, 2018. Then it was up to all the states to deschedule and deregulate. So this is what's happened here. Our Attorney General released a statement following the Farm Bill, immediately saying that we are okay to buy, sell, possess CBD products as long as they contain less than 0.3% THC by weight. Our particular brand happens to contain less than 0, as we
less
said
than
earlier.
0.
Less than
less
0.
than 0.3.
Less than
You can't have less than 0.
You can. We're gonna go back and watch the beginning of this interview. Hopefully it'll be archived so you can
What is
listen.
less than 0? It has negative THC.
It has typically less than 0.0015.
There we go.
There we go.
There we go.
Yeah.
There we go. There's
Depends
the,
on how many decimal points you want to talk
Yeah.
about.
I got it. Okay.
So it had to be deregulated by the state after the federal government did this, and then once the state descheduled it, then it had to go through the state, through the governor, and then the different state boards had to make it legal for pharmacists to prescribe. I called the chiropractor board today, and I was informed that their next meeting is July the 18th and 19th, I think, and they think that it'll probably pass for chiropractors as well. But right now, chiropractors can't legally dispense CBD oil.
Well, I'm going to call it there,
Okay.
okay, and tell you how much I enjoyed seeing you guys today.
We enjoyed it.
Janice Randall is Compounding Solutions,
Mhm.
right? What is the phone number?
661-2633, and you can also remember this, 661-C-MED, which stands for Compounded Medicines.
Area code 205, because maybe some people are
Gotcha.
out of state. And then also you're on Facebook, Compounding Solutions
Yep,
is
we
on
have a Facebook site.
Okay,
Okay.
all right.
Thank you.
Thank you. I enjoyed it. Good to see you. I appreciate it.
I mean, 2 Janices.
I know. It was fun. Thanks, Blake. Appreciate it.